This video will look at how to prepare your insulin pen. Your pen will look something like this, but may vary slightly. However, they will work in the same way. The insulin comes in small cartridges. Make sure you check that they are in date before being used. Spare cartridges should be stored in a fridge until needed. Once a cartridge is fitted into your pen, it is safe to use for 28 days before it must be changed. Your pen doesn't need to be kept in the fridge. To put a cartridge into your pen, remove the cap, then twist and unclip the two halves. The cartridge then fits into the barrel. It can only go in one way with the threaded end exposed so the needle can be attached. Each time you take your insulin, you will need to attach a new needle to the pen. Here is a disposable needle in its packaging. To attach the needle to the pen, firstly peel off the foil and twist the needle onto the end of the pen. Then remove the clear cap and the inner coloured cap. Keep the clear cap to help you remove the needle later, but the inner cap can be thrown away straight away. Once attached to the pen, the first important step is to make sure that the needle is not blocked. This involves priming the needle by doing an air shot. If this is not done, you will not be aware if there is a problem with the needle, and the dead space in the needle will not be filled, which will reduce the dose of insulin you are actually getting. This has to be done every time you do an injection, as you will be using a new needle every time. To do the air shot to prime the needle, you need to hold the pen, pull out the end, dial 1 or 2 units, and press the button on the end of the pen. You should see insulin squirt out of the needle. If you do not see any insulin, then repeat this step. Once you are happy that you have seen insulin coming out of the needle, you will need to set your dose. Use the dial at the top of the pen to set the correct number or dose to be given. To begin with, your diabetes team will write your dose down in your blood glucose diary.